From the News Channel 5 Network, this is Inside Politics.
Hello, everyone. I'm News Channel 5's political analyst, Pat Nolan. Welcome to Inside Politics. TennCare is a long-standing state program that provides health care coverage for more than 1.4 million children and low-income individuals in Tennessee. It dates back to the early 1990s and the administration of the late Governor Ned McWherter. The program has often been controversial, usually due to rising costs that in turn causes cutbacks in service and those who are covered in the program. Now the supermajority of the Republicans in the Tennessee General Assembly, along with Governor Bill Lee, are seeking to change TennCare into a block grant program from the federal government. What will that mean, and is it a good public policy concept? Our guest today on Inside Politics ought to be able to give us some perspective about that. She is Melinda Buntin, the Mike Kerr Professor of Healthcare Policy and the Chair of the Department of Health Policy at Vanderbilt University Medical Center. Dr. Buntin, welcome to the program. Let's start out with the basics. I think I got a pretty high-level audience, but they may not be aware of exactly what is a block grant and how would that be better or worse for TennCare.
So a block grant, at the simple terms, is a lump sum amount, just a fixed amount. So what happens right now with TennCare is something called a match. You can think about it, for every dollar the state puts in, the federal government contributes $2.
And it's not limited. I mean, if more people come in and need the help, more money comes from the state, more money comes from the feds to pay for it.
So at its most basic form, a block grant would just take a fixed amount of money, so no more, if we spend more, have more people covered, would you get more. But what TennCare is asking for in this specific block grant, and what the General Assembly has directed that TennCare ask for, is something a little bit different than a strict block grant. They've asked for part of the money they get from the federal government to be a strict block grant.
They're carving out some programs to be covered under the block grant and some programs not to be covered.
That is exactly right. And they've also said if the population of people eligible for TennCare grows, then they also want to get extra.
That sounds like an awful lot to ask for any governmental agency, particularly if you've got bean counters involved. Are they going to have a problem negotiating this with the federal government, even though the Trump administration wants to get more states, and Tennessee would be the first to get on a block grant system?
Well, that is literally, in this case, the billion-dollar question. Because the state has asked for very favorable financial terms from the federal government in return for accepting the risk of the block grant for a part of the population.
Now, I understand that there are some of the places that seem to be carved out are children with complex needs, children in state custody, Medicare dual eligible folks, pharmacy costs, which is prescription, and also administrative costs will be carved out. So is that a good thing or a bad thing? Do those people still say unlimited amount depending on what the demand is, or are they going to be limited?
So those people will continue under the current system if they're carved out. So all those groups, the children in state custody, the older people who are eligible for Medicare and Medicaid, and then all of the costs of prescription drugs, those would be set aside and they'd continue just as they do today.
Some people the state likes what they're trying to do because it gives them a lot more flexibility. Flexibility to do what? Sometimes the state has not had a great record with the flexibility they've had of cutting people off and not telling them about it and changing other rules in there that people didn't like very much, especially those who were receiving the service.
So it is an interesting thing. TennCare already operates with far more flexibility than most state Medicaid programs do. And that's because they already operate under very special arrangements with the federal government under what's called a research and demonstration waiver. So TennCare is asking for even more flexibility, and what they want to be able to do is change those benefits or coverage without going to the federal government first and asking for permission.
There's been a lot of talk about the state wanting to do this because they'd be the first in the nation to do this, but given the different status and the more advanced status that Tennessee already has, you're kind of doubtful a lot of states are going to follow our lead and come in and want to get a block grant. Is that right? Well,
one of the things that's unique about Tennessee is that we already operate, as we just discussed, under a special research and demonstration program from the federal government. TennCare has been operating this way since 1994, and they already have these flexibilities, many flexibilities. They already contract with managed care organizations like Blue Cross of Tennessee to offer benefits through private insurers. They already run a lot of innovative innovative programs.
And if a state wants to come to a block grant, they have to set all that up for the first time.
Well, they have to come in with a way that they think they're actually going to do better under the block grant than they're currently doing. So since Tennessee is already doing all of these things, and it's already able, and this is the real trick, to say, look, federal government, we've already been saving you money, and now in our block grant, we want to share in those savings. Tennessee is actually asking the federal government to give them more money under the block grant than they're currently receiving.
And they're asking for more money. They're offering to share any savings back with the federal government and with the state being able to take that money and do what they want to with it, I assume, within the general government. Is that right?
Not just in the future, they want to share in the savings they've already achieved. And that's why Tennessee is in such a unique position to ask for this block grant that other states aren't in.
But it doesn't appear this is necessarily healthcare driven. It's more dollar driven. Is this really an effort by the state to recapture some dollars and capture future dollars that they don't have to spend on healthcare? There's lots of needs for healthcare, and there are a lot of people who are not covered by TennCare that could be added if they expanded this money. States already turned down money under the Affordable Care Act, so why suddenly are they so interested in returning money and getting money?
So that's one of the really big questions that people have about the proposal. And it really is just a proposal at this point in time. We don't know where, again, things will end up after negotiations with the federal government are done. It is clear from the act passed by the General Assembly that part of the motivation for this is to get a better deal, so to speak, for Tennessee. And how they would use the flexibility is not entirely clear. There are some examples that are laid out in the proposal, and the proposal does state, and the governor has said, that the effort is not to cut benefits. But again, once the state is given those flexibilities, if the federal government agrees, we don't know exactly what will happen in the future.
Healthcare costs never go down; they always go up. It's like death and taxes. Long term, aren't we looking, if we put a limit on some of this, aren't we going to bump into a situation where we don't have enough money to pay for the people that are on the program? You either have to change eligibility or cut services.
So that, of course, is the biggest fear. Yes, the state has asked for the amount of money in the block grant to go up by an inflation factor every year, and they've chosen one that is larger than costs have been growing in recent years. So they're trying to bake in a little extra there. But truly, we don't know. Predicting the future is hard there.
On the political side, several Democratic leaders in Washington that are involved in healthcare, particularly in Congress, already say that what the Trump administration and Tennessee are trying to do with this block grant is not legal, that it's not allowed under the law. Are they right?
So I have yet to see a legal scholar who thinks that block grants, traditional block grants, are legal under the current state. What Tennessee is asking for, it's possible that the Trump administration lawyers will find a way to approve, but I don't know the path to that, and I feel almost certain that this would be challenged in court.
Dr. Melinda Buntin from Vanderbilt University, the Medical Center. She's the Mike Kerr Professor of Healthcare Policy and the Chairman of the Department of Health Policy at the Vanderbilt Medical Center. Back to continue our conversation about TennCare going to a block grant after this break.